In 1996, there was an executive order from President Clinton to really look and protect our children from these environmental threats. So these centers, along with NIEHS and EPA, we collaborated in 1999 to launch the First Center program. It included community-based research, intervention programs, where we were out across 10 sites looking at what are the issues that are most concerned for those specific communities. So we weren't in everybody's community and backyard, but we really did assess and take a preliminary look at what were the things that were affecting communities, what they were concerned with, and we did something about it. Now, this program has grown in the past 17 years to be over 22 centers funded, 14 currently, and lead, I have to say, hasn't been, luckily, a big issue for most of the centers, but besides Bruce Landfear's in Cincinnati. And what we've learned from these is kind of goes back to what Mark was talking about. It is a soup. The children are vulnerable. They're developing pound per pound. They eat more, drink more, breathe more. Their organ systems are developing. So we look at that as the most vulnerable of our population, plus we are their voice. They don't have a voice for us. So these centers have really worked proactively to not only address the issues that the research community have, but also what the community are concerned with. And they've learned a lot. They've learned a lot that it's not one chemical. They've tried to develop programs and protocols and methods to look at more than one chemical. They've been at the forefront, taking the translation of their research through the community outreach translation course back to the community and to the policymakers and to the stakeholders to communicate their findings. And they've had some big impact, not only in research, but also in regulatory, as EPA is one of our partners. And we work collaboratively with EPA and NIH scientists to really look at what these issues are. But Mark is absolutely right. It's not one chemical. We're dealing with pesticides, consumer products. Lead being a source from water has not been looked at specifically in our centers. They do some screening and also get some feedback from those public health departments. And that's where we are today. So this is not surprising for us. But the agencies are working collectively to address the problem. It may seem that a little late, but we're doing the best we can.